Okay, so can you also share with us the common causes of kidney disease and also who would fall in the typical high risk category?
So let us stick to our own country. And as I already shared with you, 18% of us have kidney disease. This is brought out by a very well conducted study called as SEEK study, Screening and Early Evaluation of Kidney Disease, which was conducted across the length and breadth of our country. And out of this 18%, if you look at 100 people with kidney disease, 40 of them have kidney disease because of diabetes or hypertension. So 40% of the burden is because of sugar not being under control, hypertension not being under control. The other 60% is because of several causes. I will just go through what are the commonest of them. There is an entity known as chronic glomerulonephritis, another entity known as chronic interstitial nephritis. Both of them are inflammation in the kidney, which happens over many years, dropping the kidney function to almost zero in a period of 5 years or 10 years, depending upon what is the underlying cause. The fourth common cause could be stone disease in certain parts of our country. All of you must be aware people have kidney stones, especially in dry and hot areas like Rajasthan, Delhi, Hyderabad. They're all called stone belt of the country. So whenever you form a stone, you do damage a part of the kidney. More importantly, when you have a stone and you have pain, you take a lot of medications, which again damages the kidney. Next to this stone disease, you have urinary tract infections, especially in the women, which are treated with antibiotics again and again. Both the infections recurrent and the medications can cause kidney disease to progress relentlessly. After this, probably the most common thing would be medications themselves. People use painkillers, people use antibiotics, people use very simple drugs like proton pump inhibitors. Many of us may be taking for acidity, pantoprazole. All these things can cause kidney disease. In fact, in our country, among the top 5 drugs, pantoprazole is number 3 or so to cause kidney disease, followed only by painkillers, antibiotics, and certain other substances. Simple things now we see in our practice, like vitamin D can cause kidney disease when taken without reason or without indication. Following this, there are a group of disorders known as cystic diseases of the kidney. These are usually by birth genetic diseases, and patients have small fluid filled spaces in the kidney called cysts, and these cysts progress in size to cause kidney failure. So, to summarize, we have around 8 common reasons, out of which diabetes and hypertension take the major chunk of 40% of the causes of the kidney disease. So, the other part of the question is regarding who is at risk. So, one of the things we have learned now is kidney disease always starts off in a very silent way, progresses relentlessly to reach the dialysis stage. If you can identify somebody very early in the disease, it is definitely possible to prevent and progress into dialysis. So we have made a list of things as per our understanding today. So as I already mentioned, every diabetic is at high risk. And in our country, if you take 100 diabetics, almost 40% of them will have kidney disease. So every diabetic is at high risk. Every patient of high blood pressure is at high risk. Every person of a patient in the family. That means if my family member has kidney disease, automatically I become a high risk member to have kidney disease tomorrow. Every person who develops kidney stones on and off is a high risk patient. Every person who takes medications on and off, including antibiotics, painkillers, and certain other chronic medications, is at risk. Every person who is obese as per the BMI is at risk. So when we have these list of people, we want everybody to ask themselves, because it is such a common thing in our country, do I fall into this category? If I fall into this category, every year we have to have a very simple test of blood test called serum creatinine, Also, nowadays, many labs do what is called as a estimated glomerular filtration rate, which is done using the serum creatinine. Also, your blood pressure reading, sugar reading, and hemoglobin and urinary protein. Very simple things should be possible within 500 rupees. And this can be done once in a year. And as soon as one of them is abnormal, please see a kidney doctor so that lot of things can be done to prevent further progression of the kidney disease.